I'm Dr. Saunders. This is an educational video on blood clot prevention. Blood clots are also called DVTs, or deep venous thromboses. And these are problems that can happen after surgery. The truth is they can happen to people that haven't had surgery, and it's common actually to have blood clots in the hospital. So blood clot prevention is important for everyone and for any operation. There are operations that are more prone to blood clots, and so we take an increased worry over these operations. But in general, they are something that we need to always be concerned about. An interesting statistic or fact about blood clots is that more people die of blood clots each year than car accidents and breast cancer combined. And that sounds scary. But with the proper prevention and preventative techniques that I'm going to talk about right now, the chance of blood clots are very low. I take my cosmetic surgery extremely seriously. I practice exclusively cosmetic surgery. And it's just what I do and only what I do. But to have the best surgery, we also want to minimize any complication or risks. And so we're going to focus on how we minimize our risks of blood clots. There is an acronym that I've come up with these preventative measures, and it's called PAIL, P-A-I-L. And so each letter stands for something. P is for patient position. A is for ambulation or early ambulation. I is for the invisible bicycle, and L is for leg compression stockings. And I'm going to review each one right now. In addition to this video, there's an educational writing on this topic that I recommend that you review. It's on this topic as well, and so it's similar, but goes in a slightly different way. And that's on my webpage under menu and then educational writings and under the tummy tuck section. So back to the acronym PAIL. P is for position. Now the position that we're in is called a tilted back lounge chair position. And this will be demonstrated by the photo that is going to come right now. And so if you saw that picture, the legs are elevated because blood, like water, drains downhill. And so people often say, my legs are elevated, and they're in a lounge chair and their legs are up from a down position. I'm seated right now, and this is actually a blood clot prone position because the blood can pool or clot because it's dependent. Blood, like water, drains downhill. So by getting the legs up in that tilted back lounge chair position I'm talking about, the blood drains from the legs, and this minimizes the chance of it pooling. So you have to get it up above your heart. One description is toes above the nose, but the heart is the main factor. So the legs are elevated, so blood is draining down. And that's the P in PAIL, and it's called the invisible bicycle, or the position that I recommend that you're in after surgery. Okay, so the next letter is A, or ambulation. Ambulation means walking or moving, and the term in medicine is early ambulation. So that means you get up, you're walking around. Walking around minimizes the development of the blood clots in the legs. The idea is that as we're moving, and studies have shown this very clearly, that the muscles pump the blood, and so then the blood moves, and moving blood has a much decreased chance of forming blood clots. So that's very important. And often it's asked, how much should I walk around? So it's described as up and about, which usually means 6 to 10 times a day, but that just might be for 5 to 10 minutes. So the importance of the position is because if you say you're out of bed for 10 times a day for 10 minutes, that's 100 minutes. That's still less than 2 hours. So you're actually going to be lying down for a substantial amount of time, something like 22 hours. So that's why the importance of the invisible bicycle and the leg elevation. But early ambulation is critically important, and please follow that as well. I is the invisible bicycle. So what that means is the legs are moving. These are my arms, of course, but they're moving like this. The nurses will demonstrate this for you, as will I. So the legs are pumping as if you're riding a bicycle, which you're not. And if you do one leg at a time, that's better. It causes less pain. So if we're doing these preventative measures after a tummy tuck, which can involve muscle tightening, then moving of the legs can cause some pain. But if you do one leg at a time, then that dramatically decreases any discomfort, and often there's no discomfort at all. And the movement of the legs is very much like the walking or early ambulation. So by doing the invisible bicycle, while we're in bed, we're pumping the legs, pumping the feet as well, and these will help us decrease the risks of blood clot formation after the surgery. The last one is called leg compression devices or leg compression stockings. During surgery, you'll actually have machines applied to your legs that are called sequential compression devices, which are just machines that squeeze your legs while you're asleep, because blood clots can start during surgery. So what we do is we put these machines on your legs, and I do it for every operation that I do, and it squeezes your legs. There's no risk to having them, and the squeezing of the legs squeezes out the blood and pushes the blood forward and helps us minimize the risk of blood clot. After surgery, and these should be purchased before, are leg compression stockings. There's different heights. I recommend the knee highs. You don't need the thigh highs, they're uncomfortable, knee highs. And they're usually 12 to 15 millimeters of mercury, but it's also just moderate compression or tightness. Too loose isn't doing anything, too tight is too difficult, and most people don't need that because the venous system in the legs is a low pressure system, so it's usually a more moderate tightness that are relatively comfortable. Make sure it's not too tight at the knee or constricting it like a tourniquet. That would not be beneficial for us. So comfortable but snug leg compression stockings. These can be purchased at drugstores, online, Amazon, medical supply stores. They're extremely common to buy. So to summarize and to repeat for clarity purposes, the measures that we're going to take to minimize our risks of blood clots can be remembered with the acronym PAIL. P-A-I-L. P is for patient position, and that's the tilted back lounge chair. That means that the legs are up above your heart to help blood drain. A is for ambulation, which is early ambulation, and by doing that, we get up and walk around, makes the blood move and diminishes any chance of blood clot. I is the invisible bicycle, where our legs are pumping as if we were riding a stationary bicycle, and that's to be done as frequently as possible. And L is leg compression stockings. All these things should be followed to give us the best results. And I'll remind my patients that when they're coming in the car to visit me or coming to a doctor's office to be seen, this is when you want to pump the legs. So sometimes when they're doing it at home, but then they get in the car and they might have a 30-minute drive or an hour drive, and they're sitting in the office, and I try to minimize any weight, but there's waiting and they're not pumping their legs. Now we're in the seated position, which is a blood clot prone position. So this is when we actually want to do it as well. So you're in the car on the way to the doctor's, and you're doing your invisible bicycle and pumping your legs at that time. So these are very important things that I believe everyone should see this video and do these techniques to help us. In my experience, the risk is very, very low if we follow these instructions. So I hope you have found this educational video helpful, and it's something that I want you guys to remember and watch more than once before and even after your surgery. And this way we can decrease risks and have the best results after our cosmetic surgery. Thank you.